evening, everyone. So a little bit of a change from my usual health and wellness content. We are talking about dog bite prevention because this is actually a health and wellness issue, and we need to be doing as much as we can to prevent the rising number of dog bites. So if you like what you're listening to, do hit the follow and subscribe button and let me know in the comments what you want to learn about. So without further ado, let me share my presentation and we can kick off here. So this is my beautiful dog, Treacle. So she was a lovely, friendly dog, very demure, very great with children, great with adults. But this is her fearful. And this is a real problem because kids will often not recognize that this is a fearful dog. And she was actually very scared of someone at the dog training establishment we were at. And instead of actually just letting her be, he kept trying to make friends with her, and she just got more and more scared. She never bit him or anything. But I use this to highlight that actually any dog can actually bite if they're put under pressure. So for those of you who don't know me, I'm an emergency medicine doctor. I work at a major trauma centre, but outside of medicine, I'm pretty much all about the dogs. I've got 6 dogs and 2 cats, and I'm almost qualified as a dog behaviourist. I've done the Aggression in Dogs master course as well, and I'm an animal aromatherapy specialist as well as some other things as well. And for the past probably 11 years, I've been studying the dog bites in children and adults on a formal and informal basis. And it's getting worse. And there's so many ways that we could actually interrupt these bites by just understanding a bit more about dogs and why they're actually biting and how we can prevent it. So first of all, we're going to look at why it matters, the implications of bites, and we'll talk about a couple of cases and then look at what we can do to prevent and also some resources as well. So the vast majority of bites are completely and utterly preventable. And, you know, we always say prevention is better than cure, don't we? And this is really true. So 91% of dog bites happen in the home with a dog the child knows. So these are figures from Dogs Trust. And this certainly backs up, which I have found in my own study on dog bites as well. So most bites are actually not from aggression. They're from fear, like my dog, Treacle. They're from play. They're from accidents. They're from because of pain. There's so many reasons that a dog can bite, and only a small amount are actually from a truly aggressive dog. But obviously, they're the ones that always hit the news. So lack of supervision and poor management is a key factor in dog bites. So why does it matter? Well, in a 10-year period, dog bites have gone up by 47%. So that's for NHS treatment. Police recorded dog attacks have gone up by 21% in a 1-year period. I actually suspect that actual dog attacks are more than that, but people just don't tend to report them. In 2023, there were over 6,000 recorded incidents of dog bites requiring hospital admission. So it's a huge problem. And dog injuries by age group. Well, it's not just children that get bitten. It's all across the ages. So this information, although a lot of it's going to be around children, it applies to adults as well. Fatalities from dog attacks have also increased. So in 2022, there were 6 deaths, and in 2023, there were 16 in England and Wales. And nobody really knows why those numbers have increased. We're not sure whether it's due to lockdown or the huge rise in dog ownership or poor management, social media. We don't actually know why, but deaths have definitely increased. Now, I actually put into Gemini AI what deaths had happened over last year, and these were all the ones that Gemini came up with. So it's 10. Now, as you can see, the vast majority are actually XL bullies. There's a Belgian Malinois in there as well. And I don't know whether this is just because of the deaths that were reported, because they're XL bullies. It obviously happened after the ban. So the actual statistics aren't out yet. So I'll be interested to see whether or not it's actually more than just what's listed here. So important to remember that small dogs can kill too. So Harry Harper was only 8 days old when he was killed by the family Jack Russell. Now, the baby was in a cot on the in the kitchen on the table. Grandma went out to just wave her children off to school, and the dog was left alone. And when she came back in, the dog was curled up in the cot with the baby. and there was one bite wound to the baby's head. I don't doubt that that dog wasn't aggressive. I think that dog probably just mouthed the baby's head because that's what dogs do. And unfortunately, baby skulls are soft and dogs' teeth are sharp, and it was just an opportune bite that actually caused it to cause a fatal brain hemorrhage. But obviously, if the dog and the child hadn't been together, the story would have been different. So we did a dog bite case note review in 2024. And what we actually found was that out of 26 pediatric patients, these were the different dog bites that had these are the different dogs that had bitten. So as you can see, it's very varied across the board. We've got beagles, we've got a Malinois, we've got a Labrador there, a Shih Tzu. So any dog can bite. And just because you have a breed that is supposed to be really friendly doesn't mean that when push comes to shove, they won't bite. So what about the cost to the NHS? Well, the total costs of hospital attendance and admission related dog bites amounts to more than 70 million for 2017 to 2018. So it's a huge cost. And in Wales, they've got estimates at 300,000, but actually the true cost is likely to be significantly higher, possibly in the millions there as well. So what about implications? Well, physical implications, tissue and muscle damage, nerve damage, infections, scarring and disfigurement, and chronic pain can all result from the actual bite. But obviously it goes into other details as well, with the psychological and other implications such as post-traumatic stress disorder, emotional trauma, self-esteem issues, and financial as well. Because obviously if you've been bitten and you're off work, you can't work, or perhaps you've got a child that's been bitten and you're having to take a lot of time off work. Also lifestyle changes as well, and also legal issues, whether or not the dogs you have the dog can involve safeguarding and police involvement, or perhaps legal issues regarding someone else who perhaps owns the dog. Now, I'm very privileged to be able to share with you the story of Clifford. I first got to know Clifford really through the owners who presented to the A&E having been bitten by him. Now, I want you to take out of your mind the fact that he's a big dog. He is a cane corso, but this actually had nothing to do with the reason for him biting. It does have a bearing on the size of bite and what actually, you know, the type of bite he had and the strength behind it. But actually the reason he bit has nothing to do with that. Clifford was a very well-loved dog. I've seen so many videos of him, so many photos, and I wish I'd been able to meet him. All I see is a very well-loved dog, loved by owners who were very knowledgeable about him and looked after him very well. Now, Clifford had lived with them for 14 months, and during that time, he had not shown any aggression whatsoever. Prior to that, he'd been in Manchester Dogs Home, and he was known to the female owner, Annabelle, because she was working there, and he hadn't shown any aggression. Now, they didn't know why he'd ended up in rescue. They suspect he might have been a stud dog because he had sort of some rough hair under his belly, but they don't actually know. But he'd never shown any aggression. He lived with them very happily. I've seen lovely video footage. Now, on the day in question, it was during last autumn, so we're in fireworks season, and fireworks had been going off in the preceding weeks, and he'd started to get quite anxious about him. But the owners had been very responsible and had taken him to the vets to get checked out. Prior to 2 weeks before the attack happened, he'd also hit his head, slipping, and had a seizure. He'd never had seizures before, but again, they'd done the responsible thing and taken him to the vets. And they were talking about actually having anti-anxiety meds for him because of the fireworks, but the vet had wanted to just get a blood test first. I'm not quite sure why, but that's why he wasn't on them. But obviously, those meds do take several weeks to get into the system. On the day in question, they go out for a walk, a normal walk they do through in the daytime so that he's had his walk before the fireworks go off. They get back home, no problems. They start to play with him, but he doesn't actually want to play. So again, the owners do the right thing and they don't force him. They just leave him alone. They let him do his own thing. And they're both in the bedroom, and Arnis is lying on the floor when the dog, Clifford, suddenly appears round and just goes straight for Arnis. He attacks him on his head, who then holds his hand up to protect himself and gets bitten on the arm. Now, Annabelle had to pull Clifford off, tightening his collar, so it was the right thing to do that way, tighten it off so he would release. Now, the thing to remember with these situations is when a dog is in fear or in this zone, you are not going to be able to get them off very easily. And this is where it becomes difficult with a bigger dog. Let's just put it into the context of a boxer, for example. So a boxer, a trained boxer, is in the ring, the bell goes off and he stops fighting. But if he was attacked in an alley with people punching him, it would take far more than someone just saying, hey, the police are here, it's okay, you can stop, to stop him doing that. And that's exactly the same for a dog. Now, what I think happened with Clifford is a culmination of trigger stacking. And this is where basically there's lots of things going on. The cortisol is risen, and it takes something very small for the dog to then react and attack. And, you know, we know fireworks were going off. We know he was getting anxious about that. We know he had a seizure a couple of weeks before. And so was there some kind of, did he have a focal seizure? Was there some kind of neurological problem? But we also know that he's over 8. And so 80% of dogs over the age of 8 can have arthritis. And in that age group as well, you find that they can start to develop canine cognitive dysfunction. So again, these things could have been going on with Clifford at the time. Now, maybe the reason he didn't want to play was because he was in pain, but he wasn't showing it, because 20% of dogs don't actually show this. So, you know, what might have happened is, I know, I don't live far from them, that at sort of 3:30 in the afternoon, sometimes we had fireworks going off in the street with kids cycling up the street, letting off rockets. So it's quite possible that he heard something that the owners couldn't hear, because dogs have a much better hearing. He's had all these things going on. He'd had fireworks for weeks. Maybe he's feeling a little bit poorly, maybe something neurological is going on, maybe he's in pain, and all of a sudden it's the straw that broke the camel's back and he just goes for harness. Maybe he had a focal seizure. We'll never truly know. But it's interesting, because I think this is one of these examples where I don't think that this bite was preventable. I think this was just trigger stacking and a perfect storm of things that all happened together that couldn't have been prevented, because the owners did everything right. You know, they got the vet help. That's really important. They backed off when he didn't want to play. They just left him alone. They'd walked him responsibly. They weren't trying. They were making sure that he'd had all his needs met, and that they were doing their best to address his fireworks anxiety. And sometimes, unfortunately, with the best will in the world, people still get bitten. But I really much hope that perhaps Clifford's legacy is to teach you some of those learning points, that actually, you know, make sure you're taking a dog to a vet if there's any kind of behavioral or physical change. You know, address those things like anxiety. If the dog doesn't want to play, back off. So perhaps we can use some of those things that the owners, Annabelle and Arnis, did right, to actually remember that these things can actually prevent dog bites. Sorry, I just had to end the recording there and brief it temporarily, because my elderly dog, who had life-saving surgery on Friday for bloat with no risk factors whatsoever, was crying. So I just needed to go and make sure he was okay. So I hope we can use sort of the sad story of Clifford as sort of a learning point for prevention. And you know, just recognize really that dog bites can involve a whole host of different factors. And, you know, interrupting all those little steps at some point can likely prevent dog bites. It wouldn't have made any difference with Clifford, unfortunately. But, you know, in some cases, it certainly would have done. So what prevention is done currently? Well, I did a survey and sent it out to people who had had children who are under the age of 5, to see what guidance they got from either midwives or health visitors. 85% of people said none, and those that didn't find it any help either. So, which was really disappointing, as you can see from the study here. So I thought I'd go onto the NHS website to see, you know, surely they must do something about dog bites on there. And no, they don't. Nothing about dog bites at all, which I find absolutely shocking, because it is a sort of a welfare issue. So what can you do? So first of all, introducing a new baby. So before the baby arrives, it's get the baby doll out, baby doll work, make this all really normal. Get your furniture ready as well, so the dog's used to these different things in the house. Practice lead walking around the buggy, because although that's not directly related to dog bites, it's going to make your life so much easier if you've had some practice. Because this is me with my dogs in the stroller, and if they're not used to walking, they can weave in front, they can get their leads caught in the wheel and things like that. So the more you can do to practice, the better you are going to be, and it's going to be easier. Okay, so then we get the baby, the newborn and onwards. Cage the baby. So the dog's used to roaming around the house. Cage the baby. Create safe zones, changing stations, play zones, feeding zones, sleep zones. Okay, the baby won't be needing to move around early. But have these areas that the dog's not allowed in, so that you've got safe zones for the child. Thank you, Rowan. Come on in then. Okay, now important, although not dogs, but don't forget cats, because cats can suffocate, because cats like to curl up somewhere warm. So cat nets can be very, very useful. And take your time. Remember, it is a marathon, not a sprint. And so you don't have to get your dog socialized with your child in a week. If you've got all these barriers up and doing it safely, it's going to be much better. And though, you'll forge a much better relationship than doing it rushed. Toddlers, teach them how to touch the dog. So start with a toy and get the child to model you. So this is really important. And also remember to stroke a dog at the shoulder and use one hand. Okay. Now, I remember a few years ago, we had Dogs Trust coming to the pediatric emergency department, and they had this life-size border collie, and there was this young child that wanted to play horsey with the dog. And we were trying to explain to the child, no, you mustn't do that. This is how you stroke the child. And the mother was like, well, I don't see the problem. It's a toy. And we were like, yeah, but they're modeling behavior. So just be very aware that children will model. And so we don't want them climbing on the big toy dog, because they might do that to a real dog. And the more we can do to, teach them how to behave, the better and safer it's going to be. So supervision and rules about interaction. So, this is really important. I used to run a flyball team, and the kids used to love to do ball collecting. And it was very much a case of only when the dogs are not running and they're held. And, the children knew that that was the rule. And if they broke the rule, they weren't allowed to do it. Teach the child to always throw toys, and teach your dog to drop them. And also, I would have toys that are dogs' toys and children's toys, and they will learn. Because actually, this is one of my dog's toys, but actually it looks very much like a child's toy as well. So it's really, you can see how dogs can get confused and go and grab children's toys. And then obviously the child wants the dog's toy as well. Daily interactions to create boredom around dogs. You don't want it to be like something that's really exciting, because that can potentially wind the dog up. So you just want to make it very, very normal all the time. And also, if you're a sort of a dog owner, and just be mindful of what you can do as you're walking around. Maybe you interact with children as well. Today I had some children run up, and then they stopped, and then they suddenly went, oh, can we stroke the dog? And I was like, yes, and well done for saying that. That's the right thing to do. So choose the dog for your lifestyle. This is so important. So too many people are choosing the dog that they like the look of, and not the one that's going to suit their lifestyle. And that then leads to behavior problems. And, I am seeing, and I know a lot of my sort of behavior colleagues are seeing, an awful lot of dogs coming into rescue because they've been in homes that aren't suitable for them. I've got Springer Spaniels because I love to have a really active dog. I do a lot of stuff with them. But people get Spaniels because they look cute, and then they wonder why they've got behavior problems, because they're actually doing nothing but just giving them a little street walk, and they're not meeting any of their other enrichment needs at all. This is my little Bambi in the arms of my friend's father. He is from Romania, but he has got traits in there that are clearly lapdog related, and he is more than happy to be that lapdog. So just be aware that, the different breeds have the different characteristics, and get the dog to choose the dog for your lifestyle. Research where you get them from as well. So get get recommendations for breeders, because just because someone might be a Kennel Club accredited breeder doesn't actually mean that they're a good breeder. Bizarre as that sounds, it is true. And so you need to get recommendations from people. There's a lot of people that will look like a good breeder, but actually they're from puppy farms, and they'll look like they're in a regular house and everything, but it's not. It's a puppy farm dog, and they can have behavior and health problems. And also be mindful of rescues as well. There's some great rescues, but there's also some really poor rescues as well. And there's particularly the overseas ones that can be really bad. I've got 3 overseas dogs. I'm not anti-overseas, but unfortunately what a lot of so-called rescues is they're just picking dogs up off the street who actually don't need to be rescued. Those dogs were absolutely fine living on the street. That's how they were bred, and then they're bringing them into homes, which is an essential captivity for them, and then they're having behavior problems, and it's they're not happy. And a lot of the time these dogs are not assessed around children, and people are bringing them in going, oh yeah, they're fine with kids, and actually they don't have a clue because they don't even know anything about the dog, and it's just for the money. Now there's some brilliant rescues managing overseas dogs as well, but you've just got to be really mindful and get recommendations. And personally, I'm a trustee for the charity Warpaws. I won't home check for someone who's got a child under 12, because I just think it's too big a risk, and especially with the dogs that we've got, because mostly they're big and they're street dogs, and it's just no. So I'm just going to talk about little Elle Doherty, who died last year, cute little 7-month-old. So I've only really got with what I've read in the paper, and I'm sort of putting things together, and I might be making certain assumptions, but I'm going to tell you what those assumptions are. So first of all, Elle Doherty was killed by the family Malinois. Now, the dog, I believe, was about 3 years old. They had another dog that was 15 years old, which was a French bulldog. So I'm going to make an assumption here that perhaps they chose the dog for the look rather than the lifestyle, because it's an odd combination. Now, the problem is Belgian Malinois are a dog not for the sort of the novice dog owner, not for the uninitiated, and in the wrong homes they will have behaviour problems. And again, I know a lot of my friends have come across this. I'm often seeing Malinois needing to be rehomed that have originally been in a so-called pet home, and the owners can't cope. Now, I do know that dog had behaviour problems and so the owners had been responsible and got a behaviourist involved. Now, there was a few things that the behaviourist said that was quoted in the paper about the dog being an alpha male and things, and I'm like wondering if the behaviourist was someone who subscribes to the dominance theory of aggression, which is a debunked the dominance theory of sort of dog behaviour, which is debunked now. And has been debunked for quite a few years, but it just made me wonder, and therefore the advice that perhaps the owners got wasn't the best. But anyway, they saw a dog behaviourist and the behaviour improved. And then the behaviour was starting to dip again, and they were looking to get the behaviourist back on board. And obviously this has coincided with Elle being sort of 6 or 7 months old and starting to crawl and do more things, and the dog's now having these other behaviour traits. So they were going to have another session with the behaviourist, but they were going on holiday. And so there was a delay. Now, I don't know whether the dog was in kennels on holiday or with a relative or where the dog was for the holiday, but you've obviously got a shift in its normal environment, and it's been on holiday. So you've already got behaviour problems with this dog. You've got the dog having been on holiday, the owner's away and the dog's been in, say, kennels. So you've got lots of things that have gone on in the dog's life to cause it stress. On the day in question, the parents are both in the room. There was actually cameras up, so they were able to capture a lot of it that came up, and there was reports of that in the papers. So they're supervising. Elle's crawling around the room. The dog is very fixated on a red bag that the father has. And then the next thing you see is that the dog, they think that Ellie, as she's crawling, knocked into the dog. And I suspect the dog redirected from this bag. It was fixated on this red bag, and then it suddenly got knocked. And Elle was attacked. Now, initially, they thought the dog had attacked the French bulldog, which makes you wonder if that had happened before. It was all over in like less than a second. The parents were on it, and dog and child separated. But Elle had suffered a fatal injury to her head from one bite from the Malinois. It doesn't take a lot for a puncture bite to get through the baby's skull and cause a hemorrhage, a brain injury. But, these things could have been prevented if there'd been barriers up. So, the child's crawling, the dog's got behavior problems, have some barriers up, have a pen so that child's safe and the dog's safe while you're working through these behaviors. Supervision in this case wasn't enough, but actually that knowledge of having these behavior issues and using extra management could have actually prevented this occurring. It's, very sad situation. So daily life. So have no dog zones where your child can crawl. Have no child zones where your dog can sleep and eat. Preempt excitable events like Christmas and birthday parties and create a calm, safe area where children are not allowed to go to. Check friends' homes as well if they have a dog, because don't forget, you may be doing everything right, but actually your child goes to a friend's house and they've got a dog and they don't have any of this management in place and supervision. And so it's a risk. Keeping safe, always ask permission to stroke a dog. Don't disturb a sleeping dog. It's not nice. You wouldn't like it. No food and dog interaction. So if you're eating, the dog's away. If the dog's eating, the child's away. So don't let the child go up to that food bowl and stick their head in, because it happens. And no hugging. Dogs often don't like to be hugged. Let the dog kind of initiate what they enjoy. Never leave a child and dog alone. So that's where it's really important to have these safe zones so that you can actually go to the toilet without having to, put the child and dog somewhere. Just be mindful of this. Never get into a tug of war with a dog. Let them win, because a lot of kids are injured during the game of tuggy. And I'll cover that in a minute. No playing horse or lying on your dog. Your child will get bigger. Your dog will stay the same size but get old and with arthritis. And again, this is a risk for getting injured and getting bitten. And no teasing. Too much I'm seeing teasing, particularly on social media. So this was really interesting. A study that was done in 2023 found that a 4-year-old child would rate an angry dog as a happy dog. So this picture of my dog Treacle would actually be rated as being a happy. By the time they're 6 years old, they're able to recognize that actually this is sort of a growling dog, a barking dog. This is not a happy dog. So it's really important to actually educate children about the differences here. Never tell a dog off for growling. A dog has lots of different signals it does before biting, and growling is quite of near the top. But look at things like walking away, turning the body away. These are all calming signals that says your dog isn't happy with what's going on and that actually you need to withdraw. So, my dog that was barking at that man, he actually needed to go away and not try to make friends, because that wasn't helpful for her. She was scared. And remember, a wagging tail doesn't always mean happy. It can mean happy, but it can also mean that I'm fearful and I'm going to bite. So this is a picture that was doing the rounds of social media a few years ago. I see these kind of interactions all the time on social media with kids and dogs, and this dog is showing so many signals that it isn't happy. And parents will typically carry on filming thinking this is really good and my dog's really tolerant, and the dog is really tolerant. But why are we putting the dogs under stress? If this was a child doing this to another child and the other child getting upset, we would separate them. But because it's a dog, we expect them to just put up with all this stuff. So if the dog starts to get excited, stop and calmly go to another room. So this is what you must always tell the children. This is coming from the Kennel Club training, Safe and Sound, which I do recommend checking out. If you've child dropped food, just get them to go and tell an adult. I have seen appalling injuries when 2 dogs have got involved over food and the child was just in the way. Be a tree. So if something starts to happen, just be a tree, because you will not outrun a dog. So stop, stand still, be a tree. If you fall over, curl into a ball and stay still and quiet. Make play safe and appropriate. So I do not like the game of tuggy with kids. I see too many injuries, because even a dog that will inhibit the bite, so perhaps they've gone and bitten the finger and then gone, oh, I've bitten there, and they immediately withdraw, can still do damage because the teeth are sharp and children's skin isn't. is soft. So, you know, no tuggy, but also be aware that, you know, a child's toy looks much like a dog's toy to the dog. So you need to be very careful. Maybe have just specific toys for the dog and teach the dog that they're the toys, and teach the child that they've got their own toys, and not to try and take toys off the dog. But also be mindful of kids running around waving things, because again, the dog might see that and go, oh yeah, that's a good game, isn't it, that tuggy game, and they go and grab the toy, and actually the child gets bitten. You know, again, throwing balls, be aware of how you throw toys for the child, for the dog, because again, the dog can go and grab that toy. And you can see it's very easy for a dog when they're playing tuggy to actually miss, and you know, the child waves the toy away and the dog gets the face, and they get ears and noses, and I've seen it happen. You know, and this is all preventable with making play safe and appropriate play for the breed of dog, what they like to do, but also be mindful about different toys and how the dog might view them. So just, and again, unless you're going to learn how to play tuggy properly with a proper play cue and a proper out cue, I would just not play it with your children and the dog. So it's interesting, isn't it? And what effects social media has on dog bites. And I'm seeing stuff on social media all the time with children putting dogs under a lot of stress. So this was a video with a dog that was resource guarding the shoe. And the parents are just filming the child going right up to the dog. The face is in the dog. They're going to grab the shoe, and the dog's really growling and telling that child to actually stay back. And the parents are just still filming. And this is really concerning, because that is an accident waiting to happen. And the owners are just letting that child do that, where the dog is showing very, very clear signals that it actually isn't happy and it wants the child to back off. So trigger stacking. So this is what we obviously talked about when we were talking about Clifford. So there were lots of different facets. So this is the bucket, and all the things that are stressing your dog go out over the few days, or because of environmental pressures goes into this bucket. It's full of cortisol. When they exercise, it goes in there, the cortisol. And there's different things. Maybe a sleep will remove some of this cortisol out of the bucket. But actually, if you get too much, the bucket overflows. It's the straw that broke the camel's back. So the child, you could be going out for a walk with the dog, but maybe the dog's got arthritis and they're trying to have a sleep, and then a firework goes off, and you know that bucket's overflowing, and then the child comes up and tries to stroke it, and they snap because they've just had enough. They just want some space, and this is what happens. The bucket overflows. And, you know, obviously, as I explained with Clifford, sometimes with all the good intentions and all the management and supervision, something unforeseen happens and it's just too late. But the more you can do to prevent and manage it, and be aware of things going on in the environment, the more you can actually do what you can to prevent having a dog bite. So it all comes down to supervision, management, and education. This is really, really key. So what can you do? Well, put up posters from different areas that you work. So Dogs Trust have some brilliant posters, so do the Blue Cross. If you're in the NHS, there are training sessions from the Blue Cross, and Dogs Trust will go out to schools. So, you know, reach out to different organisations that perhaps you work for to try and get this education spread more. Share resources on social media. And if you have got a child, then this book, The Canine Commandments, is absolutely brilliant. It's written by Dr. Kendall Shepherd, who developed the Ladder of Aggression. And, you know, this is all about education and about dog behaviour and how to keep yourself safe. Now, I have a YouTube dog bite prevention playlist. So I've got other presentations on dog bites as well as some of my rants about social media and some tips about how you can prevent dog bites. So if you've got any questions at all, my beautiful paraplegic boy Bambi, do feel free to drop them in the comments, and I will make sure that I answer them, and let me know what sort of things you want to know about as well, so that I can create more content either about dog bite prevention or other health and wellness topics. That is my usual stuff. So I hope this has been useful for you. Do let me know what you want to know about, as I've said, and don't forget to hit the follow or subscribe button, depending on what platform you're listening to or watching. And I hope to see you next time. Stay safe, stay well. Bye.